Our next guest is Dr. Liz Evans, who is the CEO of the UK Medical Freedom Alliance. Over the last few years, we have witnessed tyranny in our nation and normal practice in every field, including medicine, turned upside down. Liz is here to talk about how things should be. Without further ado, to discuss medical ethics, please welcome Dr. Liz Evans.
So good morning, everyone. Thank you so much for the invitation to speak, David. It's an absolute honor to be here and to share the platform with such esteemed freedom fighters and some heroes of mine. So I'll just tell you a little bit about myself. I'm a former NHS doctor. I now work in complementary medicine, and I can attest to the power of prayer, Brian. I have a strong Christian faith, and that underpins my belief in the sanctity and dignity of every human life. So I've been a passionate campaigner on health and ethics for well over a decade. And in October 2020, I co-founded the UK Medical Freedom Alliance to challenge unethical COVID policies. And on the slide, you will see me with some of the HEART team in September 2020 as we delivered an open letter to the then Prime Minister, Liz Truss, calling for a halt to the COVID vaccine rollout to children. We campaign on issues threatening informed consent, bodily autonomy, and medical choice. And for the last 4 years, we have lobbied policymakers, decision makers, and healthcare professionals, presenting an evidence-based and rational perspective. We've also provided resources to educate and empower the public to understand and uphold their legal and ethical right to free medical choice. We've got a stand over there which you can visit to see our work or go to our website. Our first open letter was sent to the MHRA, the JCVI, and Matt Hancock in November 2020, so before the vaccine rollout, begging them not to authorise the COVID vaccines. It was a 14-page, fully referenced letter covering serious ethical and safety concerns which were already in the public domain. And we've since written and published over 60 open letters. We've run several campaigns on a range of issues, from stopping children's COVID vaccines to lifting NHS COVID restrictions and stopping the WHO power grab. We also helped set up the People's COVID Vaccine Inquiry, which was launched this summer to get vital information about the dangers of the COVID vaccines out to the public. And you can find our witness statements and video testimonies on the website up there. And we also have a podcast where we interview guests on a variety of ethical issues. So UKMFA is closely aligned in many values and concerns stated in the Heritage Party's manifesto. In recognising the sanctity of human life and the need to uphold each person's fundamental right to life and autonomy over their medical decisions. We also share a deep concern at the road of travel of our healthcare system, which has become a business model serving to enrich Big Pharma instead of delivering ethical, patient-centred medicine. This sick care service increasingly employs a one-size-fits-all, dehumanising model of care using top-down protocols. And free speech is essential for liberty. Without the ability for the public to access full information on the risks of drugs and vaccines, there can be no informed consent. So why is it imperative to fight to preserve our medical freedom and bodily autonomy? Well, I'm a huge fan of the US founding fathers, and I think Thomas Jefferson nailed it here. So I'm going to start with a brief overview of medical ethics. Then I will look at ways in which they're being threatened and undermined by government policies and global agendas. So medical ethics are the vital framework that uphold the equal value, worth, and dignity of every individual and their right to freely decide what happens to their own bodies. There's an unavoidable power imbalance in the doctor-patient relationship. So the ethical principles are essential to hold healthcare professionals accountable for their actions and to protect vulnerable patients from abuse and atrocities. As such, a healthcare professional is obliged to follow 4 key ethical principles. Autonomy is a respect for the patient's right to self-determination and the freedom to accept or reject medical interventions. Beneficence is the duty of a doctor to act for the benefit of a patient, and non-malfeasance, the duty to do no harm. And they must treat people equally with justice. So that said, it's important to understand 2 key points. The first is that medical ethics are vitally important and should be non-negotiable in a civilized society. And second, medical ethics can't just be discarded in an emergency. In a crisis, decisions are driven by fear, making abuse more likely. So we must therefore resist the urge to override individual autonomy for the greater good. The ethical practice of medicine uses a patient-centered model in which the doctor's primary duty of care is to the patient in front of them. They must act as the patient's advocate and in their best interests. Privacy and confidentiality are vital. And there's a legal and ethical requirement that informed consent must be obtained for all medical treatment, where the clinician discloses all material risks, benefits, and alternatives to treatment. Consent is only valid if it is freely given, without coercion or pressure being applied. And these medical ethics are enshrined into UK and international laws and declarations, as well as into the NHS Constitution and professional codes of practice, and you can see a few here. So that's given you your basic overview of medical ethics. Now let's see what's going wrong. So, I'm sure you will agree that during the COVID era, we have endured a pandemic of ethical violations. Government COVID policies robbed people of their most basic human rights in the name of public safety. And as we reflect on the damage done to our society and to the practice of medicine, there is an urgent need to have conversations in the political sphere, such as in this space, about the vital role of medical ethics in underpinning a civilized democratic society to ensure this never happens again. So, this slide shows what happens when the government and society abandons medical ethics. The authorities and healthcare professionals committed numerous ethical violations in the name of public health during COVID. Elderly people were starved of touch, and many died alone, uncomforted by loved ones. Children were denied an education, were forced to wear face masks for hours a day when they did return to school, and were robbed of months of socialization and playing with their friends. And basic rights such as travel and even entry to shops were made contingent on taking a vaccine, being tested, or wearing a mask. As a Christian, and I think Brian said this earlier, I believe you can judge a tree by its fruit. So, to understand if a policy is right or wrong, we must look at the impact. And looking at these pictures, we see pain, suffering, and cruelty. This is what unethical looks like. And most importantly, this was a choice. Political and medical decisions were made in a moral and ethical vacuum. Government, public health authorities, and most importantly, the medical profession, failed to uphold the ethical principles that have always framed and constrained the delivery of healthcare. This led to significant, avoidable suffering and death, and it set a very dangerous precedent. There needs to be a clear ethical boundary between the state and the individual to prevent the state abusing its power to force medical treatment on a sovereign individual. We must reject the prevailing anti-human greater good ideology and return to the Christian values that have always underpinned Western civilization. upholding each person's inalienable, God-given right to life and liberty. And during COVID, we saw an unprecedented use of coercion, fear, and lies, as we have heard from the previous speakers, to pressure and shame people into acting against their best interests. And tragically, most of the medical profession and public were deceived by incessant government and media messaging that we should trust the science and that the vaccines were our only way out. And unbelievably, we even saw bribes used in the vaccine rollout with government collusion, used especially to persuade our young people to accept vaccines. So just wanted to look at the COVID vaccine rollout in particular, where the ethical violations were off the scale. What were we thinking? We rolled out a completely new gene-based technology with no long-term safety data, not just to those at most risk from COVID, but to those at little or no risk, including, unbelievably, children and pregnant women. You don't need to be a doctor or scientist to recognize that this goes against all common sense. It violated well-established medical practice and discarded the precautionary principle, making it reckless in the extreme. There was a complete lack of transparency and honesty from government and public health bodies, who aggressively promoted the vaccines with an unscientific one-size-fits-all approach. Benefits were grossly overstated and risks were downplayed or denied. It's arguable that no one gave valid, informed consent to these products, which, unbelievably, were given in many cases by volunteer non-medics in car parks. And then we had vaccine mandates, which crossed the line into overt medical tyranny. Where there is risk, there must be choice. Shockingly, in 2021, care workers were denied the right to decline a medical intervention without losing their jobs and livelihoods. This extreme form of coercion led to 40,000 care workers leaving the profession in protest. And tragically, many others accepted a vaccine against their will to keep their job. We strongly challenge any claim that we had no choice due to the threat from COVID. We always have a choice, and the choices made were unwise and unethical and should never have been allowed, actually, regardless of the safety profile of the jabs. Now, obviously, in 2024, there is a huge body of real-world data and evidence showing irrefutably that the COVID vaccines are neither safe nor effective. And the emerging fallout from the ill-judged COVID vaccine rollout is arguably the biggest avoidable public health disaster in human history. So at UKMFA, we have joined thousands of doctors and scientists around the world in calling for an immediate, complete halt to the COVID mRNA vaccine rollout. It is indefensible that public health authorities are still recommending the injection of these unsafe, dangerous products into anyone, let alone into children and pregnant women. Those responsible must be held to account, and there must be justice and compensation for the vaccine injured and bereaved. So, having set the scene, as we emerge from the COVID era and the normalization of the unethical in policies and public discourse, we have identified multiple threats to our medical freedom and bodily autonomy, including the state seeking to cut families out of medical decisions for the children and elderly. We have ethical doctors being persecuted by the GMC and NHS. The WHO and UN are mounting a power grab to create global governance through healthcare systems, eroding individual autonomy. We have the unethical use of do not resuscitate orders and end-of-life protocols, and calls for the legalization of assisted dying, which is a euphemism for euthanasia. There are also calls for the liberalization of abortion laws, even to decriminalise it up to birth. Then we have the threat to our children from transgender ideology in medicine, with the use of puberty blockers, cross-sex hormones, and mutilating and sterilising surgery. There is the bid to expand the mass medication of the public with fluoride in drinking water, which violates the laws of informed consent and the right to refuse medical treatments. You may not be aware that since May 2020, organ donation has operated as an opt-out system. When you die, the state now has the right to take your organs against your relatives' wishes, unless you actively opted out while alive on the government website. So I suggest you do that today. We've also just started a campaign opposing a proposed Orwellian public health bill in Northern Ireland. This bill would increase the power of the state in public health emergency, enshrining into law the ability to mandate the administration of vaccines and other treatments, and other draconian measures undermining medical ethics and human rights. The deadline for submissions to the public consultation is the 14th of October, and there are details on our website as to how to do that. So there's not obviously time to cover all these. I'm just going to focus on the first 4 topics. So let's first look at how the state is threatening parental authority over healthcare decisions for their children. We see parents being sidelined in favour of the NHS and state in several ways, including the increasing medicalisation of schools as a setting to vaccinate children. We have the NHS directing propaganda and fear-mongering at children, and the NHS even seeking to deal directly with children. So I'm sure most of us received 1 or 2 vaccines in school, which was usually given by a school nurse who knew you. However, as the parent of 4 children, I have personally seen a marked increase in visits to schools by NHS vaccination teams over the last few years, and an increase in the number of vaccines being offered. Schools should be a place to deliver education to a child, not healthcare. It is not an appropriate place to administer vaccines, particularly by medical professionals who don't know the individual child or their medical histories. The child's own GP or practice nurse are far better placed to perform this role. Giving vaccines in school inevitably compromises confidentiality and privacy. Pupils are acutely aware which children in their class have not taken a particular vaccine, which can be a source of great stress and shame for the unvaccinated. Without their parents for support and protection, children are highly susceptible to peer pressure and the opinions of their teachers. They will feel pressure to follow the crowd. Then we have the use of Gillick competence, which enables a child under 16 to consent to vaccination in the absence of parental consent or knowledge. It is a serious concern and open to abuse. All these factors create a coercive and unsafe environment that is completely inappropriate for a medical decision. Now, in January this year, we discovered this disturbing policy briefing from the London School of Hygiene and Tropical Medicine on school-age immunisation services in England, known as SACE. And it was lobbying for the increased use of schools to promote and meet vaccine targets. And there's some excerpts on the slide. It calls for all schools to be required by law to support SACE in their vaccine delivery, including to provide a space on site, a dedicated staff member, access to parent data, dissemination of material, and allocated time in the curriculum, and enforced by Ofsted and local authorities, which is highly coercive. Schools must retain their independence and be allowed to make autonomous decisions as to whether they wish to be involved in state-run public health programs based on their assessment of what is in the best interest of the children in their care. And I'm sure you will not be surprised to learn that this assault on schools is being driven by powerful vested interests. We discovered that the London School of Hygiene and Tropical Medicine, who produced the briefing, is closely linked with the Vaccine Confidence Project. The funders and partners of this project include pharmaceutical companies such as Merck, AstraZeneca, and GSK, who stand to profit from any increase in vaccine uptake. Therefore, the briefing is not a neutral document, but instead is funded by powerful vested interest whose business models involve getting needles into the arms of as many children as possible. The line between education and indoctrination is blurring, as schools are given an active role in promoting and delivering the vaccination programme. And the policy briefing advocates for the teaching of, quotes, accurate information, and also, quotes, providing appropriate educational materials that promote vaccine confidence. So children being taught what to think and not how to think. And indeed, teachings on vaccine and vaccine ideology creep into many parts of the curriculum, from nursery to A-levels. There are thousands of vaccine learning resources online for teachers and schools to use, including these examples I found. From a book on vaccines aimed at babies, to a reading comprehension on the rise of the anti-vaxxers, to a biology lesson task to create a leaflet for a doctor's surgery to encourage vaccination, and a biology lesson discussion as to whether we are morally required to get vaccinated. Whether you are for or against vaccination, I hope you agree that this material is powerful corporate propaganda and should therefore have no place in a school. Over the last 4 years, we have seen the power of the pharmaceutical industry and how lucrative a business model it is to vaccinate all healthy children. So with such powerful vested interests lobbying for more and more access to our children, it is surely time to draw a line and take all healthcare out of schools and back into general practice where it belongs. Now, this may shock you. We come to the NHS seeking to deal directly with children, bypassing parents altogether. We learned, and we were horrified to learn this, that the NHS is now sending letters directly to children by post. This letter was sent to a child about to turn 13, informing them that they can now make their own healthcare decisions, including making appointments and seeing a doctor or nurse alone. And if you have a quick read through this, I'm sure you will be as outraged as we were at the content. The worst example of this overreach was this similar letter sent by a GP practice for the attention of a 10-year-old and shared with us by their concerned parent. Now, I'm sure you will agree that no child should be subject to direct approaches from a GP practice regarding their medical care. It is deeply sinister. The letters raise several red flags and serious safeguarding concerns. It's completely unacceptable for any adult to contact other people's children or attempt to involve them in adult processes and decisions. To suggest that a child of 10 shares their personal contact details or travels alone to the practice to fill in forms they are unlikely to comprehend is surely a child protection issue. Then stating that a child's wish for confidentiality would always be respected unless there is a risk of serious harm is very alarming. The secrecy of the communications that would result between the child and GP practice would be a red flag in all other interactions between a child and an unrelated adult. Then removing parents' details from the child's record and requiring a child to actively opt in to consent to parental involvement means that parents could find themselves unable to access medical care for their child. Children under 16 simply don't have the skills or knowledge to make complex medical decisions alone without parental support and input. And the burden of responsibility of making these secret health decisions would cause great stress and anxiety. So it's clear our children are being targeted in a predatory way and need our protection. This behaviour constitutes a direct attack by the state through the NHS on our families, and that threatens the right of parents to be involved in healthcare decisions for their own children. We have a moral and ethical duty as a society to protect children from harm and exploitation. Parents must stand firm and protect their children from the nanny state and big pharma interests. At the UKMFA, we advocate for the following guidelines to be implemented. Firstly, medical discussions, decisions and interventions for children should only happen in the privacy of a consultation with their own GP or practice nurse. And secondly, the child should always be accompanied by a parent. The healthcare professional should discuss risks and benefits in an open and non-coercive way, and the decision made by parents should be accepted and respected. And it's not just our children at risk. This was a horrifying story which I covered earlier this year in TCW about Sarah, a 96-year-old woman with dementia whose sons have power of attorney and care for her at home. Now, Sarah was unvaccinated for COVID. This non-consent was clearly documented in her medical notes. Despite this, while alone at home between care visits, she was visited unannounced by a NHS vaccination nurse. When the doorbell was unanswered, he let himself in, administered a COVID vaccine, and left 6 minutes later. This was all caught on CCTV. Heartbreakingly, Sarah sustained a significant vaccine injury, leaving her unable to use both her legs and worsening her incontinence, thus increasing her care needs and decreasing her quality of life. This outrageous story should be a wake-up call to us all. We must bring an end to this toxic culture which undermines individual autonomy and dignity, and demand that healthcare professionals return to ethical, humane, patient-centred medicine. And now to doctors. So during the COVID era, most of the medical profession failed to speak out against unethical policies or protect their patients. They were largely silent and complicit, losing sight of the fact that their primary duty of care is to the patient in front of them, not to the NHS, not to their employer, not to the government or wider public. But on the flip side, we have witnessed good, ethical doctors, such as the ones on this slide, threatened and punished, acting as their patient's advocate for treating COVID or voicing vaccine safety concerns. These and many other doctors face ongoing GMC investigations. Some have already been sacked or struck off, and other doctors are now terrified to speak out. It's a serious situation when doctors cannot risk speaking out in their professional capacity and duty to raise patient safety concerns, and are not allowed to use their clinical skills and experience to treat patients in the way they judge best outside of NHS protocols. And there are, as our previous speakers said, there are powerful global agendas driving the destruction of medical ethics, and I'll just cover them really briefly in the next couple of slides. It's undeniable that the WHO is mounting a concerted bid to increase its wealth, power and scope and become the de facto decision-making authority for global public health. The UN are launching similar assaults on our autonomy in their common agenda and their Pact for the Future adopted at the Summit of the Future last weekend. One Health is a global project to centralize power with the WHO under the umbrella of health, giving the WHO the authority to control every aspect of human life without regard for national sovereignty or human rights, effectively creating a global health dictatorship. It is baked into the proposed IHR amendments and pandemic treaty. These will create the legal framework and infrastructure to make the One Health agenda a reality. And the instruments could give the WHO enforcement powers regarding anything that has the potential to impact public health, rolling out a one-size-fits-all approach across the planet. There would no longer be a doctor-patient relationship. just an unelected, distant bureaucrat practicing medicine on strangers by decree, and no ability for doctors to act in the best interest of their individual patient or for informed consent to be practiced. So in conclusion, COVID has set a precedent, normalizing the unethical. We are faced with a stark and urgent choice between Hippocratic, ethical, patient-centered medicine or technocratic, dehumanizing, protocol-driven medicine. If doctors cannot act autonomously and ethically and are mandated to follow top-down, one-size-fits-all policies and protocols, they are reduced to being agents of the state. Patients are dehumanized, and atrocities will inevitably follow. With hundreds of mRNA vaccines in the pipeline and the WHO seeking more power and control, we must urgently re-establish ethical red lines that can never be crossed by policymakers or healthcare workers, regardless of the circumstances. And I'm sure many of you recognize that at its core, we are in a battle against evil. A coordinated push to remove the intrinsic value of every human life, creating a dystopian digital slave system. This could be the biggest challenge humanity has ever faced and will require a strong collective resistance, starting in this room. We must shine a light on the agenda and actions being rolled out and expose the lies, the greed, and the anti-human ideology. So how can we move forward? Well, part of the solution requires a doctor-driven return to patient-centered medicine. Human doctors are required to apply ethical principles, moral values, and interpretations to science. This is the art of medicine, encompassing the observation, the intuition, experience, wisdom, compassion, and innovation of the individual doctor, who must be free to act in their best clinical and professional judgment. Politicians and bureaucrats have no place in the consulting room or the practice of medicine on individuals. Governments must never again be allowed to override individual medical choice by mandating medical treatments or vaccines to access basic human rights such as employment or travel. The safest and most effective way to manage any health crisis is through the decentralization of healthcare decisions, using a localized, community-based response with individual doctors practicing ethical, patient-centered medicine. And it's also clear that our political system is corrupted and broken. It is not serving ordinary people, but instead collaborating with big corporations and unelected NGOs to serve their interests. Medical ethics have been removed from political conversations and the framing of policies. I hope and pray that new parties, such as the Heritage Party, and honourable politicians, such as David, and many of you in the room, can start to challenge this new normal and offer a more humane vision of how to run society and healthcare systems, respecting and honouring the sanctity of every life. Thank you for listening.